Hello everyone, we are from student group discussion B7 and we are about to present our student project with the topic deep vein thrombosis. First of all, let me introduce my name. My name is Fiona Nathanael Santoso with my last 3 digit student number ID are 249. And here are our members as you can see on the slide. So our student project will be divided into 3 chapters. The first one is chapter 1 introduction, the second one is chapter 2 content, and the third one is chapter 3 conclusion and suggestion. And the presentation will be continued by my friend. Thank you.
Hello, doctors and friends. My name is Jovita Theodora Liu with last 3 digits 114. Now I'll explain to you about the introduction. The first one is the background information. Deep vein thrombosis, or DVT, is the formation of a blood clot in a deep vein as a result of a combination of different risk factors. The symptoms of DVT often lack specificity or adequacy for diagnosis, with approximately half of DVT sufferers displaying no symptoms. Risk factors associated with DVT encompass age, obesity, and genetic elements. Anticoagulants form the cornerstone of DVT treatment. The next one is problem formulation. There is 9 problems that will be explained in the objective. There's also 9 objectives. And then the benefit of this writing is to enhance knowledge and understanding of deep vein thrombosis or DVT. In addition, this student project is also expected to be a reference for another research related to DVT. That's all from me. Thank you.
Now, we will move to the chapter 2, which is the content, and the first one is the definition of defense thrombosis. My name is Jeremy Nathanael Dihardja with the last 3 digits of my student's number are 26. Defense thrombosis, or DVT, is a significant health condition characterized by blood clots forming in the deep veins, primarily in the legs, though they can also occur in other parts of the body, affecting approximately 1.6 of 1,000 individuals globally each year. Defense thrombosis poses serious health risks by obstructing the blood flow, potentially leading to venous reflux and severe complications. The anatomic distribution of defense thrombosis differs from one patient to another, and the most commonly affected veins are peroneal veins, anterior tibial veins, and posterior tibial veins, which make up to 40% of the cases. Defense thrombosis stands out as a critical concern in the cardiovascular health, only second to heart attacks and strokes in severity. The risk of defense thrombosis escalates when clots travel to the lungs, causing pulmonary embolism, which can dramatically increase the risk of mortality.
Hello everyone, my name is Fernando Ghosali and my last digit of the number is 036. Now I'll explain about the epidemiology of the vein thrombosis. The vein thrombosis and pulmonary embolism are common and often silent and thus go undiagnosed or are only picked up at autopsy. Therefore, the incidence and prevalence are often underestimated. It is thought the annual incidence of DVT is 80 cases per 100 cases, with a prevalence of lower limb DVT of 1 case per 1,000 population. A multi-center study conducted in 12 Indonesian hospitals involved 360 hospitalized patients with acute medical conditions lasting over 3 days showed that 40.33% of the total patients studied had DVT. The mortality rate within 30 days is noted to be 6% among patients with DVT, typically associated with complications, particularly pulmonary embolism. That's all from me. Thank you.
Okay, so greetings, doctors and friends. My name is Abel Sianipar with the last digit of student number 118. Now I'll be explaining about the etiology of DVT. So DVT, or deep vein thrombosis, is a serious condition caused by blood clots forming in deep veins, usually in the legs. Several factors can increase your risk of developing this DVT, and some factors may reduce your blood flow or increase the pressures in the veins, such as bed rest, long flights, pregnancy, tumors, or narrowed veins. Damage to the vein wall from trauma, surgery, catheters, or previous DVT can also increase